Okay, you can start, Emelda. Thank you.
All right. So good day, everyone. My name is Dr. Emelda Chukwu. I am a medical microbiologist and a research scientist at the Microbiology Department of the Nigerian Institute of Medical Research. And thank you for giving me this opportunity to give updates of my research activity. My research interest is epidemiology of infectious diseases and genetic basis of antimicrobial resistance. And my interest in infectious disease started in the area of anaerobic bacteriology, where we try to elucidate the genes that are responsible for virulence, as well as identify genes for diagnosis. And we're able to look into odontogenic infections, foodborne pathogens, as well as diarrhea in adults. But my current research focus now is on antimicrobial resistance and antimicrobial stewardship. So I'm currently leading a team of multidisciplinary professionals who are looking at the burden of antimicrobial resistance and how to mitigate the emergence and spread of resistance. And we identified that the problem is that antimicrobial resistance is a global problem that has threatened to reverse the gains that has been made in the use of antibiotics in treatment of infection. And this means that there is fewer drugs that are available for treatment of both emerging and re-emerging infectious diseases. And antimicrobial resistant pathogens cause infections that are more severe and less responsive to treatment. So currently, over 700,000 deaths occur per year due to resistant infections. And this is more common in the lower middle income countries, as well as also high income countries. And it is projected that if this current trend continues, by the year 2050, we are looking at about 10 million people dying per year due to resistant infection. And this will cost about $100 trillion to treat infections caused by resistant bacteria. So the team, what we try to do is we try to get the baseline information because we identified that there's paucity of data on antimicrobial resistance in the country. So we did a national survey to ascertain the level of knowledge, attitude, and practice of the general public, as well as the prescribers on antimicrobial resistance. So for the national study on the general public, we identified some gaps, and that is that we noted that there is high level of self-medication, which was due to the fact that people had access to over-the-counter purchase of antibiotics, and then there was the overall low knowledge of antimicrobial resistance. There was 8.3, and then generally people could not understand the role they had to play, and they felt that they were powerless to stop the spread of antimicrobial resistance. So on the part of the health workers, on contrary, we noted that they had a fairly moderate level of knowledge on antimicrobial resistance. However, this did not translate to improvement in the practice and prescription of antibiotics. So we noted that most of them still prescribed antibiotics for common viral infections like sore throat, measles, common cold and flu. And then some of them also admitted that sometimes they feel pressured to prescribe antibiotics just to be on the safe side. So then we also identified that stewardship is also a problem because one of the major drivers of resistance is overprescription and overuse of antibiotics in the hospitals. So we tried to do a needs assessment of the healthcare facilities in Lagos to identify gaps and then to ascertain the current level of stewardship program going on in these facilities. This study identified that there was little or no stewardship program. Over 80% of them did not have any stewardship program. And then when the few people that had, it was not operating optimally. So there was gaps that needed to be filled in this area. So we also used this recommendation to identify interventions for stewardship, and we were able to invite some prescribers, medical doctors and pharmacists for training in my institute last year on antimicrobial stewardship. So then to identify the burden of resistance in Nigeria, we did a pilot survey in Lagos using 4 sentinel sites, mostly general hospitals, to collect specimen and isolate from clinical isolate to look at the profile of resistance, as well as identify resistant genes that are presently common in the environment. This study revealed high burden of antimicrobial resistance in Lagos State, and it's used as a preliminary step towards monitoring resistance trends in order to prevent further development and spread of resistance. We also identify some challenge that if there is going to be a national surveillance structure for AMR, then there are certain things that need to be put in place. There are certain foundational deficits that need to be tackled before we could be able to have a holistic approach towards tackling antimicrobial resistance in the country. So what is mostly, so we have rolled out some other projects like trying to track resistance using wastewater and also from environments. But what is more important is for everybody to know and understand the problem of AMR and the way in which their behavior, attitude affects the emergence of AMR, and then the role they have to play. So everybody needs to understand that they have a role to play, both the public, the general public, the patients, the prescribers, the environmentalists, even the animal health care workers. So it has to be a holistic approach before we will be able to tackle AMR, and that is the essence of the One Health approach. So that is where we are looking at now, trying to make sure that there is the interrelationship between the environment, the humans, and the animals, and we have to really attack the three of them at a time to be able to tackle it holistically. So this is what I have. Thank you for listening.
Great, thanks, Emelda.